Elaine Candelora, Tony Frame, Deborah Wainwright, Anna Verzone, and Karin Reed. The views or opinions expressed in this presentation are solely those of the authors and do not necessarily reflect the views or opinions of Frontier Nursing University. The United States is the only developed country that doesn't guarantee paid leave for workers who are new parents. The United States lags far behind in financial support for parental leave. Canada, France, and the Netherlands all offer over 15 weeks, and the UK offers 40 weeks. However, in the United States, the Federal Family Medical Leave Act gives workers the right to 12 weeks of unpaid leave, and only if the company meets certain conditions. The Family and Medical Leave Act, or FMLA, was enacted in 1993 to grant up to 12 weeks of unpaid job-protected leave to eligible employees who need to care for their children. Unfortunately, there hasn't been much federal legislation designated to supporting working families since this time. The consequences are shocking. Only 12% of workers have access to paid family leave through employers. Less than half of all workers are covered by unpaid leave. 25% of women either quit or are let go when they have a baby. Of those who get only partial pay or nothing at all, a third borrow money and or dip into their savings. 15% go on public assistance. While many think of paid parental leave only as additional costs, there are several ways that it ultimately leads to an increased economic and social benefit. 3 states, California, New Jersey, and Rhode Island, offer guaranteed paid leave. These programs are funded by the employees' payroll deductions. These payroll deductions cost individuals and employees less than $1 a week. Having state-mandated paid family leave hasn't hurt most employers' bottom lines. In a survey of California business owners, 89 to 99% said that programs had a positive or no negative effect on their profitability and performance. 78% of millennials are part of a dual career couple. Fact, 38% of U.S. millennials would move to another country with paid parental leave benefits. Training new employees has been estimated to be 21% of the employee's annual salary and even higher for more skilled labor. 86% of millennials are less likely to quit if paid parental leave is offered. Studies reveal that in European countries where paid parental leave is offered, there is an increased labor force participation for women and a decrease in unemployment. This leads to a boost in overall productivity. Paid parental leave can have outstanding effects on the national economy. It can lower unemployment rates and have more capital available to put back into the economy, reduce reliance on public assistance. Women who return to work after taking paid leave are about 40% less likely to receive public assistance in the year after giving birth. And there is a wide wage gap between men and women in the same jobs. Part of this is related to the time that women spend out of the workforce unpaid to have children. With paid leave, women are able to build more tenure and experience in their jobs, and this can raise their earnings and help close the pay gap. Workers are more likely to maintain their pre-leave wage level if they stay with the same employer than if they must find a new job. This can raise their long-term earnings, contribute to the health of the economy. There are numerous health effects for the parent and the child for having extended maternity leave. 6 months is the optimal maternity leave for a mother to reduce her risk of postpartum depression. The cost of untreated postpartum depression for just one mother is $7,200 due to lack of productivity. And the estimated total loss a year in the United States is $5.7 billion due to medical treatment and lack of productivity in mothers who do not have significant maternity leave. Infants of mothers who receive paid maternity leave have slightly increased birth weights and lower incidence of preterm birth. Every month of paid maternity leave can reduce infants' mortality rates by up to 13% in low or middle income families. Longer periods of bonding can prevent behavioral and developmental delays, and children who attend daycares are more prone to frequent illnesses. Preterm births result in the loss of up to $26 billion a year in the United States, and the average cost of child care for just one child is $10,468 a year. The goal for breastfeeding is that 60% of babies should be breastfed for at least 6 months. In the United States, 51% of babies were breastfed at 6 months. Full-time working mothers who received 12 weeks of paid maternity leave were 3 times more likely to breastfeed their babies and twice as likely to still be breastfeeding at 6 months than those who did not receive paid maternity leave. Mothers who are expected to return to work within 6 weeks were 40% less likely to plan to breastfeed than those who returned to work within 12 weeks. If 90% of infants in the U.S. were breastfed for 6 months, it would save $13 billion a year and save approximately 911 lives. Over $5 million of these dollars could be saved in just childhood illness-related expenses alone.
Paid maternity leave has shown a decrease in infant and child mortality by 20%. You may be asking yourself, what does this exactly mean? It means that many lives are saved with paid maternity leave. If this has not just convinced you that paid maternity leave matters, then I'd invite you to listen to the following story about Julie. Julie is a 31-year-old woman that worked as a secretary before she had her baby. However, she could not financially afford to have 12 weeks off with no pay. Her husband works, but both incomes are needed to make ends meet. Julie had to return back to work 4 weeks after she had her baby. She experienced stress and maternal anxiety, and she eventually had to stop breastfeeding. She went into depression, and she eventually lost her job and had to go on public assistance for a short time. Julie made it through her depression and got another job that was less pay. This happens more often than people think. Julie's story could have been very different if she had had paid maternity leave. She could have continued to breastfeed, had better pay, had an increase in her earnings long term, decreased health costs, and she would not have had to go on public assistance. In the long run, her employer would have also benefited more because the employer would not have lost money in retraining a new employee. The answer is clear, and that is that paid maternity leave matters, not only to the person receiving it, but it also affects the employer, families, and the economy in positive ways. The time is long overdue for the United States to have paid maternity leave. It is time to take action and vote for paid maternity leave for all the states in the United States. Access for everyone for paid maternity leave will positively impact the economy and help with better health outcomes for families. Paid maternity leave is the answer and will impact your children and future generations to come. The choice is yours to make.